A common area of concern for many men and women is submental fullness. And this really presents in 2 to 3 different ways. I can get somebody young, even in their 20s, who's not heavy set, and it's really like a family trait. They'll have this little full chin. Of course, as women age and men age, they'll get a little fullness, and that's a very early presentation of aging. And then, of course, if you're significantly older, let's say in your late 60s, it's common to have more sagginess. Now, if the skin tone's good, which is most people in their early 50s and younger, there's a couple of different options. The least invasive is probably something called Kybella, and that's a series of injections of a medicine that essentially melts the fat. Most people will need 2 sessions, spaced about 4 weeks apart. There's some inflammation afterwards, a little bit of tenderness to the area, and then a gradual improvement over time. So that's one option. Option number 2 is a treatment called smart lipo or laser lipo. I do an awful lot of this in the office. What's involved there is a very tiny incision, 2 to 3 millimeters, right behind the chin. It's an almost invisible scar. I then put some local anesthetic to fill it up, and then I put a small fiber optic laser underneath the skin, and then I move it back and forth. That'll melt the fat. It also heats up the skin so the skin will tighten. After that, I do put a very small cannula in and suction out the fat. I put one dissolving suture. Just at night, I like people to wear a little garment that goes under their neck, over their head, and it just helps give them a light pressure. And I have them do that usually for several weeks, but again, only at night in the privacy of their own home. And that gives very good results. If somebody has a lot of loose skin, no matter what their age, or if they just have poor skin tone, which unfortunately happens when we get much older, then those people generally will need a facelift. And those are really your 3 very good options for improving your neck.